Dr. Esma, today's topic is a firestarter. 7 shocking truths about dental implants versus dentures. People think it's a simple choice, but oh no, there are layers, surprises, and maybe even a twist or two waiting. And honestly, I can't wait to watch your expert face when I reveal what patients secretly assume. Spoiler, some of it is wild. Rasim,
trust me, paying their own myths every day. And when they ask whether implants or dentures are the absolute best, I always smile because the real answer is, it depends on surprising factors they never expect. But I won't spoil anything yet. Let's build that suspense. Ready to uncover the first truth?
Oh, absolutely. And for everyone watching, stay with us, because what Dr. Esma reveals later might change how you think about comfort, longevity, and even your confidence. Buckle up, this is going to get beautifully real. Dr. Esma, before we dive into the first shocking truth, let's talk about what people actually struggle with. Because honestly, I get messages daily. Someone's denture slipping during dinner, someone else afraid an implant will feel weird, and another who thinks both options are way too complicated. It's like everyone is stuck choosing between comfort, cost, and confidence.
Rasim, that's exactly what happens in real clinics. Patients walk in with stories that would surprise even seasoned dentists. One person fears their denture clicking at a job interview. Another imagines implants as a long, painful journey. But the real issue is this. Most people make decisions based on myths, not facts. And that's where the shocking truths become eye-opening.
Exactly. And when you hear the truth, you might rethink your entire plan, because the gap between what people expect and what really happens is massive. Ready for the first reveal, Dr. Esma? Dr. Esma, I think people underestimate how much this decision affects everyday life. It's not just implants or dentures, it's whether you can bite into an apple confidently, laugh without adjusting anything, or feel like yourself again. I had a viewer tell me she avoided social gatherings for years because her denture kept shifting. One tiny decision changed her confidence.
Rasim, that's so common. And on the other side, I've seen implant patients who walked in shy and walked out glowing because suddenly they could eat, speak, and smile naturally again. These improvements affect careers, relationships, even mental health. That's why understanding the truths behind each option matters more than people expect.
Exactly. And today's 7 truths are like a roadmap, helping viewers make decisions that actually fit their lives, not just their assumptions. So, Dr. Esma, shall we lift the curtain on truth number 1? Dr. Esma, before we hit truth number 1, give us a little background. Because people hear implants are popular or dentures are affordable, but they rarely see what's really happening behind the scenes. For example, I recently read that more than half of adults over 40 experience some level of tooth loss, yet many still hesitate to seek treatment.
That's absolutely true, Rasim. And I had a patient last month, a teacher, who waited years out of fear. When she finally came in, she was shocked how straightforward the options actually were. Dentures gave her temporary relief, but implants changed her long-term confidence entirely. Her story reflects millions who don't realize how transformative modern dentistry has become.
Exactly. Real people, real transformations, and stats that wake you up. Alright, Dr. Esma, time to open the door to truth number 1. Alright, Dr. Esma, give us the science. People hear implants fuse with the bone, but most don't really understand what that means. And honestly, when I first learned how titanium integrates with the jaw, my mind was blown. It's not just a screw in the bone, it's biology teaming up with engineering.
Exactly, Rasim. The process is called osseointegration, and it's fascinating. The bone cells literally grow around the implant surface, creating stability that often surpasses natural tooth roots. Contrast that with dentures, which simply rest on the gums. This difference explains why implants preserve bone, while dentures can accelerate bone loss. It's one of the key scientific truths behind long-term outcomes.
So, the shocker here is, implants don't just replace teeth, they help maintain the entire facial structure. That's a game changer, Dr. Esma. Dr. Esma, let's give people a clear roadmap, because when someone decides between implants and dentures, they often ask, what happens first? What's the sequence? So let's break it down step by step in a way that doesn't feel overwhelming. First step, a proper consultation, right?
Exactly, Rasim. Step 1 is always diagnosis, scans, gum evaluation, and bone assessment. Step 2, planning the best option. Sometimes implants, sometimes dentures, sometimes a hybrid approach. Step 3, treatment day, which is often smoother than patients expect. And step 4, healing and follow-ups. When people see the process broken down, the fear drops dramatically.
And the magic is that each step brings you closer to a natural smile. So simple, when explained by a pro like you, Dr. Esma. Dr. Esma, before people rush into decisions, let's talk about the do's and don'ts, because choosing implants or dentures isn't just about preference, it's about avoiding pitfalls. One big don't, I always hear from viewers, don't skip a second opinion. If so, true, right?
Absolutely, Rasim. And one huge do, maintain good oral hygiene, no matter which option you choose. Another don't assume dentures are maintenance-free. They require adjustments and proper cleaning. For implants, a do is protecting the surgical site while healing. Following these basics avoids most complications.
So the rule is, be informed, be consistent, and don't cut corners when it comes to your smile. Wise words, Dr. Esma.